Welcome back to Wake Up America. So former President Biden releasing a statement yesterday stating that he's been diagnosed with an aggressive form of prostate cancer that has already spread to his bones.
The former president will turn 83 in November, and he and his family are reviewing treatment options with physicians at this time, and the former president is resting comfortably in Delaware.
So for more on this, we are joined now by Director of Urologic Oncology at St. Francis Hospital and leading expert in prostate cancer, Dr. David Samadi. Dr. Samadi, good morning. Thank you for taking the time out of your busy day to join us. So as we know, he's been diagnosed with what they're calling an aggressive form of prostate cancer. Unfortunately, it has spread to his bones. So what do you make of his diagnosis right now? What can you tell us?
Well, good morning. Good to be with you. Obviously, Gleason score 9. Gleason score is basically a grading system that goes from 2 to 10. 8, 9, and 10 happen to be some of the most aggressive prostate cancers. It's unfortunate that he has metastasis to bone. This is a poor prognosis. It's a very aggressive prostate cancer. And at this point, surgery and radiation probably are not good options. And he's going to go on hormonal treatment, medications like Eligard or Lupron. These medications are not curative, but they slow down the progression of the disease. They slow down the testosterone. Testosterone is what you need, the cancer cells need in order to grow. So by reducing the amount of testosterone, these cancer cells hopefully will slow down. And as long as his cancer is sensitive to these medications, there are people that go on for many years and they live with this. The problem is that sometimes the hormones will become insensitive, they don't work, and unfortunately at that point can become a very difficult situation. The bigger question that's coming up is, how is it that a president of the United States being covered with so many doctors and going through very aggressive screening in 2025 shows up with a Gleason 9 with metastases? And that's very difficult to answer because we don't see this in America like this, especially people like President Biden and many others that are on very extreme surveillance and screening and other things. So.
Yeah, doctor, I mean, you mentioned it. I mean, the President of the United States has an annual physical exam at Walter Reed Army Medical Center. His doctor, Dr. Kevin O'Connor, last year gave him a clean bill of health in February, saying he was fit for duty. How could this have not been detected, or is it possible that it developed in the last year?
No, it usually doesn't happen all of a sudden in 1 year. This is a kind of disease that, you know, you surveil and you follow the PSAs, and I have few presidents in my practice that I've been taking care of for many years. It's not only one doctor is in charge, there's a group of doctors that are all over these kind of like politicians, and you look at the growth of the PSA and the rise of the PSA, and they get digital rectal exam. Digital rectal exam detects about 15% of prostate cancers are detected because if you feel a nodule or firmness, which in President Biden's case, that's the way they detected it, and that's the information that what we have, then they go through the biopsy and they find out that they have cancer. But it's very odd to see someone being great a year ago and completely normal with no rise of PSAs, no problem, and all of a sudden within a year they would have prostate cancer, Gleason 9 with metastasis. So something doesn't make any sense. We need to look at these PSAs for the last 10 years or so. And I hope this was not missed, or there's more to the story than what it seems like.
So from your experience, how long does this type of cancer take before it develops to this level? Are we talking several years?
Correct. That's a great answer. And usually, like when someone is diagnosed with Gleason 9, it takes about 5 to 7 years to metastasize, and probably on the average about 5 years or so to survive. So again, you know, nobody knows how long, and we wish the president well, but nobody knows how long he's going to respond to these medications. But typically, after a few years, they become insensitive to these hormones, and the outcome is not so good. Unfortunately, the prognosis is poor.
All right.
Dr. David Samadi, thanks for joining us this morning.
Thank you.